nerve 1, olfactory nerve, we are not going to test for that. Second one is optic nerve. So to test for optic nerve, we are testing for visual acuity and peripheral vision. And to test for visual acuity, so I'm going to use the Snellen test, so the patient should be able to read the letters while where the staff move 10 feet away. And the other one, peripheral visual acuity, to test for that. So I ask the patient to occlude one eye, then you should be able to follow my direction in the four quadrant and tell me what you see. What do you see?
2, 2, 2, 2.
Then the other eye.
3, 3, 3, 3.
So the next nerve is nerve 3. Well, I'm going to combine nerve 3, nerve 4, and 6 together because all those nerves, they test for eye movement. Nerve 3 is oculomotor, nerve 4 is trochlea, and nerve 6 is abducens. And to test for all these nerves, so I'm going to shine my lights into the patient's eyes. So I'm looking for the pupil size, and the pupil size should be equal and to react to light. Then I'm going to do a near reactions where I'm going to move to touch this. So the expectation is for the eye, for the pupils to converge, as in to move inward. Then we assess for ptosis, which we assess for ptosis, which is the drooping of the eye, and assess for stagmus, which is involuntary eye movement. Then the next nerve I'm testing for is nerve 5, which is a trigeminal. So I'll ask the patient to clench their teeth. So, and I'm going to palpate the temporal and the masset muscle. What I'm testing for is the contraction of those muscles. Then I'm going to test for sensation. So I'm going to do the soft one for the patient should be able to feel the sensation.
Yes, 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 yes.
Then I'm going to do the sharp one.
Yes, 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 yes.
Okay. So the next nerve is nerve 7, which is the facial one. So I'll ask the patient to smile. Can you smile for me? Frown your face. Close your eyes. So all we are looking for is just the symmetrical movement of the face. Then the next nerve is nerve 8, which is vestibulocochlear. And to perform this, I'm going to do a whisper test. So I'm going to go behind, ask the patient to occlude one here, and I'm going to say one or two words. I should be able to repeat it. 1, 2, 3. Then block the other hair too. 1, 2, 3. So what you are testing for is a hearing loss. So if he's unable to repeat the word, then there's a problem with the ear. Then the next nerve is nerve 9 and 10. So I'm going to test that 9 and 10 together. Nerve 9 is pharyngeoglossal, and the nerve 10 is vagus. So to test for this, I will ask the patient to say ah. So what we are looking for is that the soft palate should be able to move symmetrically while the uvula remain mid-line. Can you close them up? Where the uvula make, then we are looking for the nasal voices or hoarseness in the voice. And the next nerve is nerve 11, which is a spinal accessory. So I'm going to ask the patients to move their head to my resistance, side to side, and the other one too. So we are testing for the muscle contraction of SCM, which is sternocleidomastoid muscle. Then I will ask the patient to stroke their shoulder against my resistance. So we are looking for symmetric movement of the trapezius muscle. And the last nerve is nerve 12, which is a hypoglossal. I will ask the patient to stick their tongue out straight and then move it side to side. So we are looking for symmetrical movement of the tongue. And that marks the end of the test.